Hi, I'm Dr. Michelle Kittleson, and I'm a cardiologist at the Smith Heart Institute at Cedars-Sinai in Los Angeles, California, as well as a member of the National Guideline Writing Committee for the Hypertrophic Cardiomyopathy Guidelines, which offers guidance to clinicians on how to care for patients with hypertrophic cardiomyopathy. Welcome to this podcast episode, Why Understanding HCM Matters to You and Your Family. This is part of a 4-episode podcast series called What You Need to Know About HCM. Today, I'm speaking with Dr. Carolyn Ho. Dr. Ho, can you tell us a little bit about yourself and your work?
Sure, and thank you for having me today, Michelle. I'm Carolyn Ho, and I'm a cardiologist. I work at Brigham and Women's Hospital in Boston, Massachusetts, where I'm the medical director of the Cardiovascular Genetics Center. So I've spent most of my clinical time taking care of patients and families with hypertrophic cardiomyopathy. I've been trying to do research to try to better understand how to improve their care.
Dr. Carolyn Ho is quite modest. She is, in fact, one of the leading national experts, international experts on hypertrophic cardiomyopathy, as well as one of the authors, the vice chair of these national guidelines, and we've collaborated. So I'm very pleased to have you with us today, because today we're going to be discussing what hypertrophic cardiomyopathy, also known as HCM, is and its symptoms, then what may cause HCM or who may be affected, and complications or other conditions that can be associated with HCM. So just to kick things off, I'm going to explain to everyone a little bit about what HCM is and the effects it can have on your body. HCM is a condition where the heart muscle becomes thicker than normal, and this thickened heart muscle impedes or gets in the way of the flow of blood. The increased thickness can make the heart pump less efficiently, which results in reduced amount of blood being pumped to the body, and there's 2 major consequences. One can be chest discomfort and shortness of breath that limits activities. The other can be abnormal heart rhythms, which in its most severe form can lead to sudden cardiac death. Dr. Ho, can you explain a little bit about what might cause HCM and who might be at risk for it?
Absolutely. And I think that was a great overview that you just provided. When people are first being diagnosed with HCM, it's really overwhelming, the terminology and the amount of information that's coming at them all at once. So let's just break down the name first. So hypertrophic cardiomyopathy, that is merely a descriptive term to describe what we see with our eyes when we look at a patient's heart. And so hypertrophic means too thick, and cardiomyopathy means a condition that affects your heart muscle. And we specifically say it has to be thick for no clear identifiable cause. These are a lot of different things that can cause your heart muscle to become too thick. First of all, your heart is a muscle. And like any other muscle, if you make it work harder, it'll get thicker. So the same way, if you go to the gym and lift weights, your skeletal muscles will get bigger and thicker. If we make our hearts work too hard, your heart will also become bigger and thicker. And the most common way that happens in the United States and most of the world is if you have high blood pressure. So that's one reason why it's good to make sure that you have regular medical care that always consists of getting your blood pressure checked, because you don't have symptoms from high blood pressure, but it can have impact on your body and your heart. But that's not HCM. That's a thick heart because of high blood pressure. And there are other conditions that can cause the heart to become thicker as well, because the heart is storing proteins abnormally or becoming infiltrated with things that aren't supposed to be there. And again, those aren't HCM. So it's important that you and your doctor are clear about what your diagnosis is. And the important thing about HCM is that not just that your heart is thicker, but the muscle, again, is abnormal. Remember, it's a disorder of the heart muscle. So in addition to being thicker, the heart muscle can also be disordered and disorganized. So instead of being like regular bricks on a wall like it usually is, the heart muscle cells are pointing in funny angles to each other. But there's also more scar tissue in the heart, or fibrosis is the medical term. And that can also cause some issues in terms of making people more susceptible to developing heart failure or developing heart rhythm disturbances. And in terms of the cause of HCM, as we said, there's unexplained thickening of your heart muscle. So a lot of times we don't know why the heart has gotten thick. We've made sure that it's not something explainable or easily explainable, but we're not exactly sure. But there's one thing that can give us a big clue, and that's that oftentimes it can be genetic or inherited in run-in families. It suggests that there's a genetic cause or some underlying change in the DNA that's being passed from generation to generation that causes HCM. So it's important if you have a diagnosis of HCM to really reflect carefully on your family history.
Amazing. I love that overview. So, as a clinician, it's a challenge. You see a picture of a heart, an ultrasound, an echocardiogram where the walls are thick. And the first thing we must ask ourselves as the treating clinician is why? And when you go down that list of potential causes and you come up with none, then to explain the thickness, you say, perhaps this is HCM. And I'm so glad you brought up genetics. Tell us a little bit more about why, when, how we start looking at genetics for patients with HCM.
The easiest thing to do in the doctor's office, and something that all patients should discuss with their doctors and doctors should ask of their patients, is tell me about your family, your mom and your dad and your sisters and your children. At least touch on all of your first degree relatives, those individuals immediately related to you, and ask about heart history. Sometimes people in the family may not have been diagnosed with HCM, but sometimes HCM can be hinted at being present because people have had symptoms of heart failure, they've needed different types of heart surgery. Some people may have had a heart attack and died suddenly, but it wasn't necessarily really a heart attack, especially in a young, otherwise healthy person. It might have been sudden death related to HCM. So it's important to try to know about your family history and to work with your doctor to see if there are any patterns that can emerge. And there's also genetic testing for hypertrophic cardiomyopathy. So genetic changes in the genes that make up the molecular motor of the heart. So this molecular motor is called the sarcomere. It's made up of these filamentous proteins that slide against each other. They shorten and lengthen as the heart contracts and relaxes. And a change in any one of those different sarcomere genes can cause hypertrophic cardiomyopathy. So your doctor can also send genetic testing, which consists of a panel of different genes, and you're more likely to have positive genetic testing if you're younger when you're diagnosed, if you're a child, and if you have a family history of hypertrophic cardiomyopathy.
I love that. And we're getting a definition from honestly one of the experts in genetic basis of hypertrophic cardiomyopathy. So hypertrophic cardiomyopathy can have a genetic cause, in some cases inherited or passed down through families. In other cases, it might be a new genetic mutation that isn't seen in other family members. But the key is you start with the family history, which will give you a pattern, a suggestion that something inherited and familial is going on for which there might be a genetic basis. But what we know is whether there's a genetic mutation or not, there can be symptoms that can develop really in any point in someone's life. Some people get diagnosed, as you noted, as children, teenagers, others in middle age, even up to their 50s. It can happen at any age, and some people have signs or symptoms of hypertrophic cardiomyopathy for many years before they actually get a diagnosis. So the symptoms that we watch out for, that as clinicians we have a red flag, this symptom needs a deeper dive to figure out the underlying source. Exercise intolerance, chest discomfort or shortness of breath that limits activities, feeling of heart racing, palpitations, fatigue, dizziness, or lightheadedness, especially fainting and passing out episodes, feeling worse when it's hot or humid, being very sensitive to dehydration, leading to fainting, near fainting, swelling in the legs, ankles, feet, abdomen. Now, clearly, a lot of these symptoms could be benign. A lot of these symptoms could be caused by something else, but they deserve an in-depth evaluation for a potential heart-related source. There can also be good days or bad days, so be mindful of variation in symptoms, potential patterns or triggers. And when we're looking for treatments, one of the main goals is to improve quality of life, help these symptoms, and also decrease complications such as prevention of sudden cardiac death. So when you go to your doctor, when you tell them about your medical history, the symptoms are important. The family history is important, especially about the genetic source. So given all that, Dr. Ho, can you tell us a little bit about obstructive versus non-obstructive HCM? What do these terms mean and why do they matter?
That's a wonderful overview of the symptoms that people might experience and want to bring forth. And you point out there's nothing that like screams out, this is HCM. There's symptoms that are shared amongst a number of different cardiac and non-cardiac disorders. So with HCM, the heart is thick, as we talked about, but it's also usually very vigorously contracting. So when you see the heart squeeze, it looks very dynamic. The ejection fraction, which is a measure of how much blood the heart is able to eject with each beat, tends to be on the higher side of normal or even high. And sometimes because of the thick heart and the very vigorous way that it beats, there can be a narrowing or an obstruction of the outflow tract. And this is the little channel to go through to get blood into the aorta, the main blood vessel that comes out of the heart, and into the rest of the body. So sometimes a big, thick heart gets in its own way, and in combination with the mitral valve, which is also kind of crowding that area, there can be different forces present that causes there to be an obstruction to the flow of blood out of the heart. Your heart needs to generate a higher pressure, and the blood leaves at a higher velocity. And we can see that on an echo, or we can hear that with our stethoscopes as a murmur when your doctor examines you. And the thing about obstruction is that it can be related to symptoms. Again, having a hard time doing physical activity, feeling lightheaded, and people with non-obstructive HCM. The issue is not the obstruction or blockage of flow getting out of the heart, but just probably related to the heart being thick. It's also a little bit stiff, and it can be inefficient energetically, and that can cause symptoms. And thinking about the stiffness of the heart, I often tell people to think about a basketball versus a beach ball. So the heart is normally like a beach ball. And to get it to fill up, you don't really need to apply that much pressure to blow it up. But if you have HCM, your heart is more like a basketball. It's thicker and it's stiffer. So to fill it up to the amount that you want it to be filled so that you can pump out the appropriate amount of blood, you have to provide a lot more pressure to it. And that higher pressure to fill up the thick heart can get transmitted back into your lungs, and that causes people to feel breathless, particularly with exercise.
Amazing. So you have obstructive, you have non-obstructive. I always say the key to a good analogy is that everyone can understand it. Beach ball, basketball. I know nothing about sports, and that makes sense to me. So I'm going to steal that analogy. That's really, really helpful. And so step one, we want people to get properly diagnosed. We want them to get diagnosed as early as possible so that they can get the proper care and treatment. It's a chronic disease. It's not going to cure itself. So you're going to be working with your doctor and healthcare team for your lifetime. And as it progresses, there can be complications or other health problems. And I'm going to touch briefly on a few of them. Number one, that increased pressure and disorganization of the heart muscle fibers can lead to stretching of the atria, the top chambers of the heart, which leads to atrial fibrillation, which can lead to a fast or irregular heartbeat with two consequences. Number one, sometimes uncomfortable palpitations, and number two, increased risk of stroke. So these patients need medications to help their symptoms of palpitations as well as to reduce their risk of stroke. Number two, Dr. Ho touched on the mitral valve, which somehow gets caught in the mix of this thick heart muscle and can lead to issues with leakage. Some people may need interventions to help their mitral valve. Now, in severe cases, the two most dreaded complications, number one is sudden cardiac death. That is where there's dangerous ventricular arrhythmias that can lead to a cardiac arrest, the heart stopping, life-threatening, catastrophic complications. However, we have ways now to reduce that risk and save people's lives. And the other feared or dreaded complication, which is also relatively rare, would be progressive heart failure, as Dr. Ho touched on, where in rare instances, patients may require something as dramatic as a heart transplant. But the good news is, in the current era of advances in diagnostic and therapeutic interventions, patients with HCM have long-term survival that is comparable to or even better than that of the general U.S. population. So there is cause for great hope and optimism that with the right diagnosis and the right care, people can live very meaningful, fulfilling lives. But like many chronic conditions, living with HCM comes with its own challenges. But remember, this is normal. You're not alone. Be sure to share all your concerns with your healthcare team. We will be happy to address the elephant in the room, all your fears, and share these concerns with your family and friends. There are support groups, there are community groups you can connect with. This can all make a huge difference. So Dr. Ho, tell me, in light of the living with HCM, tell me about your take on lifestyle. What do you counsel patients regarding lifestyle?
That's a great question. In the past, there might have been some fear and concern about exercise around hypertrophic cardiomyopathy and maybe an increased risk of triggering one of these dangerous, potentially fatal heart rhythm events. But for most of us, exercise is good and healthy. There are very few instances in medicine where exercise is actually bad for you. And that's the same for HCM. Not surprisingly, it seems that people with HCM enjoy the benefits of exercise as anybody else. So we encourage people to get out there and try to have regular amounts of at least moderate intensity exercise of their choice. So you have to pick something that you enjoy and you can incorporate into your regular routine. So biking, swimming, walking, even running is great. You want to make sure that you're doing it at a pace that seems relatively comfortable for you, but you want to make sure that you're working up a little bit of a sweat and feeling like you're exercising.
Amazing. I think the other things we have to remember when it comes to lifestyle is the general things every patient should do to remain heart healthy: cholesterol management, blood pressure management. It's not necessarily that because you have HCM, you're at more risk for other cardiac conditions, but why give yourself more problems? So let's recap. HCM is a chronic condition where the heart muscle is thicker than normal, and this can lead to symptoms and possibly complications. Can have a genetic cause that may or may not run in families. And we want people to know that you are not alone when it comes to HCM. Your healthcare team is there for you. Support groups are available. You should feel empowered to ask your team plenty of questions and share all your concerns, as well as your goals and preferences for care. You need to be an active part of the decision-making process. Dr. Ho, this has been a great discussion. Thank you so much for joining me today. Tell me any closing thoughts or advice for our listeners.
This was absolutely fantastic, and I share your enthusiasm. This is an amazing time to be involved with HCM. There's so much interest and excitement around, and this is unprecedented for the history of this condition. So stay tuned. There's more to come.
Amazing. Thank you, Dr. Ho, and thank you to our listeners as well.